I'd like to ask you a question rooted in my personal experience. So I was born with hemophilia, which is a bleeding disorder that affects your joints. And I've been through personally some of these evolutions as change in hospitals and approach. But one of the things that was so striking was the difficulty that my parents had and I had getting adequate health insurance because I had this serious illness. So I'm one of those folks who was penalized precisely because I needed health care. Now the twist in my story is at the age of 5, I lost the ability to walk. I was in leg braces and wheelchair. And, and at the age of 12, our family moved to France, and we were actually covered under the French national health insurance system, even though we were foreign residents. So that was sort of a very broad and accepting interpretation. And as a result, I was able to make the transition out of leg braces and out of wheelchair. So I just want to give you the opportunity. I know that you are deeply familiar with the different medical and health insurance and single payer-ish type systems all over the world. Is there a system out there that is working for that country, which you think the United States would, among all of the difficult options, perhaps most easily be able to transition to?
Well, first, I'm sorry for what you went through in your personal story, but it's an amazing story. Your courage and your tenacity and your forgiveness are astounding. Your biography ought to be a show here. I think it's really amazing. Amazing story, Bob. You inspire everybody.
Thank you.
I think I'm not evading your question. I'm going to what I think is the underlying question, which is about values, which is, it's the solidarity question, which is in every single other developed country on earth, everyone, no exceptions, healthcare is a human right. They may not say it, but they act it, and you can't get left out. You won't get left out. Now there are a few exceptions because xenophobia and this vicious wave of otherness is affecting other countries too. But in general, if you're here, we care for you. We never made that commitment in America. We never made that commitment. And so your story before you went to France is a common story in this country and a nearly impossible one in most other democracies. The reason is values and the willingness to articulate values, and I think the willingness of leaders to take a stand on those values and to say so. The timidity of leaders who won't say health care is a human right worries me. But anyway, so every other country's dealt with it. Now they've dealt with it very differently. In England, for example, where I work a lot, they took probably the strongest approach, or the most pervasive approach, because starting in 1948, post-war, they said the government will finance healthcare. It's financed through taxes, and government will basically own and run healthcare, at least hospitals and specialty care. Those are governmental services. It's maybe as if we had a government care system and a government financing system. Most other countries don't quite do that. They do on the financing side. The government will play a very strong role in financing as a guarantor. For example, in France or in Germany or in the Netherlands, there's health insurance systems. They're not for profit, but they're there, and so you may get it through your employer or through a sick fund. But if all else fails, if you can't find it that way, the government will be your insurer. So that's a guarantee side. Other countries do publicly funded health care, but not at the national level, like Sweden. Funds its health care. There's national funding, but it's administered through counties. So there are many different forms. Which would work in the US? Nothing will work until we make the promise. Until somebody says, if you're here in America, you will have health care. End of story. We say that about, you will have streets to drive on, you'll have schools to put your kids in, you'll have clean air, one hopes, and you'll have health care. And I think we got to make that choice. Once we do, we can navigate to an answer. I am personally favoring more like a Swedish single-payer system where all of the funding ends up going through a single pipeline. Today, your employer is putting money into the insurance premium, and the government's you're paying your taxes to go into Medicare or Medicaid. I'd say unify the stream, and probably the mechanism to do that is government as a financer. And so you've seen Kamala Harris now become very clear about Medicare for all. Let's just take Medicare, which works pretty well, and say that's everybody's insurance from now on. If people want to retain a more pluralistic insurance system, whether you can sort of pick your insurance company and the government will be a guarantor, more like a German or Swiss system, we could do that. I personally don't, I guess we might have to politically because the insurers are so powerful, they're not going to give up easily. We could do that. The problem is we incur transaction costs. So I am confident that once we make the decision, and it has to be bipartisan, we can navigate to forms of financing that will work. The public gets very confused, if I can go on for one more minute, because remember, there's universal financing, Medicare for all. Medicare doesn't give care, it buys care, but for everybody, for every Medicare beneficiary. That's government, that's Medicare for all. It's guaranteed insurance for everybody. That's not the same as the government owning the care system or controlling it. Medicare goes into the market and buys from that hospital, depending on where the patients want to go. We can do that. We can retain pluralism in provision and unification in purchase. And to me, that's my preferred route.
I'd like to just build briefly on a conversation you and I had earlier where I came and was seeking guidance on healthcare policy, and one of the things you pointed out to me that I really wasn't aware of is that more than half Americans are already part of a comprehensive government-run or funded system. So it's Medicare and Medicaid, which you ran, and we want to hear about that. There's veterans. There are many others. The veterans, there's active duty military, and so we already have these populations, and if I believe it correctly, more than half of our population who are covered. Medicare was created because private insurance didn't want to cover old people because they get sick. Same thing with poor people. We had to create Medicaid. So it's sort of patchwork solutions. Do you think that that's part of the cultural political shift that needs to take place, is to say we've already got this. We already have single payer for people over 65.
Yeah, I think the last number I saw was something like 47% of all the care given is government. It's government-funded care. Yeah. Some of it is government-provided care. Yeah. So you had the basic there's about 150 million people, about half of us, covered through employment, commercial insurance. Mm-hmm. But then there are all these other categories you just listed. So Medicare is about 50 million, Medicaid is about 70 million. The VA, Veterans Administration, probably 8 to 10 million, I would say. The Defense Health System, again, 8 to 10 million. So when you add up, and those are systems, by the way, where the government, the VA and the Department of Defense don't just fund care, they provide care. It's more like the British model. But when you add up government's role, it's half. So we're already there. But let me point out, in this vicious era of regressive political moves, and a Senate that won't take any stands, and a president that's undercutting everything we want to be as a unified country, it's terrible, and they're hurting this. So we're seeing backing off of government finances. We've lost, I think, is it 12 million people are now lost their coverage due to these fiddling with the attacking the Affordable Care Act. We have a very strong attempt now to privatize the Veterans Administration.
Led by a secretive group that meets at Mar-a-Lago, if I remember correctly.
Indeed, and Medicaid is under terrible attack from, of all places, the administrator of CMS. Yeah. So, I mean, this is not secure, but your point is well taken, Bob. We're already deeply into government involvement in healthcare. And by the way, most of it the public welcomes. You try, nobody says take away Medicare. I mean, even on the far right, I don't think people are saying do that, because it's a popular program.
So that kind of inspired in me something from your campaign, actually. I remember you coming to the South Shore and giving your personal belief or value system of who should government work for. I believe you kind of, it should work in the early stages, the later stages, and when you need it. That's quote you gave, I can't say as
from Hubert Humphrey, yeah.
Yeah.
He said the moral test of government is in the way it deals with people at the dawn of life, children, at the twilight of life, elders, and at the shadows of life, the sick, the needy, and the disabled. That quote is, when I walked into the lobby of the Health and Human Services Department building to remember to be interviewed for becoming administrator, I remember I looked up, that's on the wall there, and I say, That's the moral test. Are we in it together?
So how do we combat the false narratives out there? Can you maybe dive into a few of them that the media has perpetuated? The for-profit organizations are certainly not trying to combat because they want to keep expanding their profits. How can we educate our community to really know what's going on out there, to realize this single payer, this better healthcare system is a possibility, and we should embrace the fight to get there together?
So much. There's so much disinformation. I will start with Bob's point, which is the government is already involved in your care in ways you like, that you want. You know, do you really not want Medicare to exist? Do you really think the VA reaching out to our the former warfighters, you don't want to offer them a promise? The Department of the Military Health System, which I spend a lot of time with, do you want our soldiers and sailors and Marines and their loved ones not to have care? The government is making that possible. So be skeptical about this idea that the government is inept and can't help you. We have to set rules, but a second is the idea that that healthcare is just fine now. It isn't. It's not. The system as it's performing now, it's got a long way to go. In IHI, the Institute for Healthcare Improvement, the organization that I used to lead and now I'm senior fellow at, we use the phrase the triple aim, which I used at Medicare. The triple aim is it's an attempt to state the world we want in healthcare, and it's better care. So if you have your heart attack, or you need your surgery, or you fall down, or you need a checkup, it should be perfect care. Safe, shouldn't hurt you, effective, let's use science, patient-centered, so you feel like you're honored and respected, timely, you're not delayed, efficient, we're not wasting your time and anyone's time, and equitable, so the color of your skin or the amount of money in your wallet isn't determining whether you get access to those. That's better care. Then there's better health. That's the upstream stuff we were talking about before, which is we want a system which is not just treating your heart attack, it's helping you not have a heart attack in the first place, which involves a whole bunch of other investments. And then lower cost. We are at 18% of our gross domestic product, $3 trillion. The next most expensive country is probably at 13 or 12. The median in the OECD nations of Europe, which have fine care, is 10.5%. Here's a figure. Take a 15-year-old boy in America, and you say, what are the chances that that boy is going to live to be 60? We're 49th in the world. Our infant mortality rates put us maybe at 30th. Our ratings of our health system by the World Health Organization, we're in the 30s if we're lucky. Our life expectancy is nowhere near top of the charts. And in addition, if you happen to be poor or black or isolated or in a rural area, it's worse. You're even worse, and it's just not right. The system is unsafe. The hospital's mortality from care, from errors in care, is tens of thousands. It's easily 50,000, probably 100,000 people a year. It doesn't use science reliably. We know what to do for most problems. There's science, but you roll dice depending on where you go. So we have a lot of work to do to make the care system better. And I frankly believe that in Medicare, we were working harder and better on that than any other funding system in the country.
So I'd like to move now into the politics of all this, and basically in two steps. One is you became the head of Medicare and Medicaid through recess appointment, and I imagine that the Republican Party just backed up a dump truck and dumped as much stuff as they could on you to slow you down. So I'd love to hear about that experience a bit. And then obviously you made the bold move to run for governor, and we've shared that interesting experience. I'd like to chat a little bit about what that was like for you. But let's start with you drop into this tornado and you're trying to move things forward while they're shooting at you every time you pop your head up. So describe a little bit what you were able to get done and what you were frustrated from getting done because of their opposition.
Well, it was probably the most amazing episode of my life. I absolutely loved it. Total surprise. I was running a global nonprofit organization with I think 140 employees and having a great time. And then Christmas Day, and 2008, I got a phone call, phone rang, and it was Senator Tom Daschle. Remember, Daschle was going to be Secretary of Health and Human Services, and I'd met with him a couple times, and I offered him some ideas about directionality for American public policy and healthcare. And he called, and out of the blue, he said, the president would like you to be the head of CMS, Centers for Medicare and Medicaid Services, which is a totally different job. It's $820 billion a year budget, serves 110 million people. I mean, it's a big thing. 5,500 employees. So I said no. Long story, we worked. Eventually I said yes. And at that point, Daschle, you remember, he got into some trouble in the confirmation, so he dropped out, and then Secretary Kathleen Sebelius was appointed, and then, so it took about a year, 15 months to work through all of that. During that period of time, that's when we lost Ted Kennedy's seat when he died, and Scott Brown got elected, and the president lost a veto-proof majority in the Senate. Boy, those days seem long gone now. Yeah. So the political environment had changed, but he had decided to make healthcare his flagship, and they created the Affordable Care Act, and they got it through Congress. I arrived in Washington. The Affordable Care Act passed in March of 2010, and I arrived in July of 2010. And it was an amazing experience, Bob. I wish everybody could be CMS administrator.
Oh, well, we can just line up and each spend a month in the job.
It's marvelous. Yeah. People said, oh, you'll be buried by the bureaucracy and the Republicans will be nasty and all that. Yeah, there was nastiness, and there was the willingness of the opposition to lie and to make up stuff about me. I mean, I didn't think people did that. Mm-hmm. They would just, out of whole cloth, make up stuff and say it. But that wasn't that was like, I don't know, noise. It was water off my back. What I really got to do was work with 5,500 really wonderful employees in a system responsible for defending the care of 110 million people. And the president and the secretary, they were very clear about that. You know, we're going to make healthcare better in America, and we expect you to. Mm-hmm. When I turned down the job, Senator Daschle, I remember, I said, Senator Daschle, you don't want me to run Medicare. He said, no, Don, I don't. I want you to change Medicare. It's time to improve things. Yeah. And so what I was able to do is take what I had done at IHI around improvement, better care, better health, lower cost, the triple aim, and bring it right into that agency with total support from the White House and the Secretary. And it was wonderful. People just rose to it. It was a great chance to give people a better sense of purpose in their lives. And then we had the Affordable Care Act, which is it's a flawed law. It has problems, but it's a great law. It was a step trying to make us a country that's fairer and more healthcare accessible, and a lot of supports for improvements in care, more continuity, more focus on quality, more patient-centeredness. It was an amazing experience. I was a recess appointee, which meant that I had full powers, and the president, I guess, hoped that at some point the political winds would shift and he'd get me confirmed. That never happened, so I didn't get confirmed, and under recess appointment,